Hello, my name is Bill Thompson, and welcome to your EMS update. Today we're going to be discussing treat and refer codes. We've got a list of 6 new treat and refer codes that are going to be in the disposition line in your outcome tab on your EPCR. Anytime you do a patient MIR, you're going to have to do a disposition code. So we either treated and transported or we treated and referred. So these are 6 new codes that are going to be integrated in there. You may see an alteration in where those codes fall into place based on the common use of those codes. People always want to know why is there a change? Why do we need to do this? Well, previously when we would treat and refer, we weren't reimbursed. And now, because we've got a new RCW through the state that allows us to bill for treat and refer, we're going to go ahead and utilize those codes and recoup some of the costs. We also have a CARES program, and that CARES program allows us to provide a better service to our high frequency, low acuity patients that we commonly see, again, high frequency. Shelley Roan is a new employee to Central Pierce Fire, and if you haven't met Shelley, she's a great individual and employee. She's going to be a great resource, as she already has been, to the people on the street, but more importantly to the people we care for. Now on to the codes. The first code is going to be a replacement code. Previously, if we treated and referred out to Dispatch Health, they were a treat and refer to mobile integrated healthcare, and now they're going to be considered just a treat and refer to licensed healthcare provider. So that's the first code. And we'll also use this code in the event that we're treating and referring them to their primary care doctor or any specialist. Perhaps you have a repeat diabetic and you've got to refer them out to, say, an endocrinologist. So treat and refer to a licensed healthcare provider. Next code that we're going to use is treat and refer to CARES team directly. Now, the CARES team, again, is a new program for us. Please look at your EMS tab on the info portal and read up on the associated link that gives you all the descriptive information about the CARES program. If you haven't done so, please do so soon. Next is our treat and refer for crisis response to the scene, which is going to be a different response than a behavioral health treat and referral. The crisis response to the scene is going to be your Catholic Community Services, mobile crisis outreach, and designated crisis responder. The designated crisis responder are those associated with Pierce County Sheriff. They ride out, and we've had great luck with those folks on the rigs already, helping out our crews and the folks that are behavioral health patients. But it's distinctly different than a behavioral health referral, and that is, again, crisis response to the scene. Our next code that we're going to utilize is going to be treat and refer to urgent care clinic. That's our multi-care clinics, our Franciscan, our Kaisers, and our City MD. Any of the commonly used, urgent care type clinics. That's the tab. The next tab that we're going to use, or next code I should say, is going to be the behavioral health provider. So treat and refer to a behavioral health provider. And that's going to be your Good Samaritan Behavioral Health, your Mobile Community Intervention Response Team, MCIRT, or Comprehensive Life Services. That's going to be more of a stationary in-house. Whether they come out afterwards or not is up to them, but it's not a mobile service that we're referring them to right now. Our next code that we refer to is treat and refer to chemical dependency use. These are going to be your people with chemical dependencies. One of the most common is going to be somebody that's on opiates, heroin, and we're trying to refer them out to a medical assist treatment team, the MAT teams that are going to be, hopefully getting these folks in a program for Suboxone or methadone. They're also mobile, Northwest Integrated Health, and they're the ones that actually specialize in this, so they're a great resource. That is the chemical dependency use. All these new codes are really important, but comprehensively, we've got to use these codes in conjunction with great documentation. While it's under the while it's under the outcome tab in disposition code, you're going to code it properly, but you also have to note it in the plan in your SOAP format. So just a quick referred to, and you're being a little bit redundant, but it is required for us to do that, and it reinforces your documentation that you actually solidified a plan for these people. you got to remember and I'm familiar with the process of leaving people at home or finding alternate means of transportation. They are our greatest liability. Anytime we don't transport somebody, we've opened ourselves up to a greater liability. Do your best to refer them out to the appropriate agencies and document it appropriately. Thank you for listening. That was your EMS update on treat and refer codes.